Apollo Cancer Centers, in collaboration with Indian Medical Association, launches a nationwide campaign Unify to notify on World Cancer Day. The campaign urges the Government of India to classify cancer as a notifiable disease, a much-needed critical step for combating the menace of the disease. India currently reports over 14 lakhs new cancer cases annually, with the number expected to rise to 15.7 lakhs by 2025. Through this initiative, the industry experts are hoping that the Government of India take the next logical move, which is to pass this bill in both the upper and lower houses in the upcoming budget session.
The various investigations which will be cost effective and how to detect this, and newer cancers are being detected nowadays, so which are becoming more of a prevalent, and like as I told, breast cancer is becoming like an epidemic in India. So Notify has a lot of advantage. Government of India in 2022, in September, the Rajya Sabha, they took this matter and it was presented to the chairman of Rajya Sabha, and the discussion is said to be there. So we, the private partners and all the stakeholders of the health industry and medical care, separate that. AQI, it varies. Last week I was there, because there was no control of the care is there. It's reaching 280, 290 there. So air quality is becoming like a big issue, though we are reducing the number of industry, but other causes of concern for the environment and has caused this respiratory disease leading on to cancer, coronary cancer, which has been very dangerous, it has been detected lately. So with all this piece of matter by putting it across the press, so with your media you can really reach our voices so that we can have a unified, notified notification for Government of India as a business. I try to follow this as a leader, because there are so many things that will change with the help of the private stakeholders, like organ transplant, rules and regulations, like infertilities. We have some standards, not less than an international one. So let us have a cancer notification as early as possible with all of you. Thank you.
It as a lifestyle disease. So if we take precaution, we can, most of the cancers are preventable and most of the cancers can be cured. So as Sir rightly said, we have to notify, and first we should have that, create awareness among the people. There is still a social stigma and the fear around the cancer. Many people think that if they get the cancer, they die. And there is a lot of emotional, psychological, the financial and the physical burden on the family, on also the patient. So prevention is better than cure. So we can try to adopt a healthy lifestyle and we can prevent many cancers. So I have done a lot of webinars on this. Online webinars and even physical seminars. Even in the IMA I have done public guest lectures regarding creating the awareness to the people about the healthy lifestyle. I am even the member of Indian Society of Lifestyle Medicine. So I thank Apollo team to taking this great initiative. I am sure this will create a huge impact on the humanity. Thank you so much.
You all know today is the World Cancer Day. So we are assembled here to spread the awareness about the cancer. The cancer is the leading cause of death in public in India and abroad. Especially it is affecting the pediatric, children also. So it's quite alarming that it is affecting the children also. So in this context, we all should come together, corporate bodies and government and medical practitioners should come together, form a formula so that it will reduce the burden on the cost of the treatment. So the main aim of this awareness campaign, the cancer treatment is very expensive. It may be chemotherapy, it may be radiotherapy, surgery. So since it involves huge burden on the socio-economic status, so it is our main concern is to bring down the cost of the treatment. And next important thing is prevention. We should aim towards the prevention of the cancer occurrence. So we should curtail at the very beginning. We should do the screening of the patients at the primary health centers and at community level, so that early detection is very important. So that will take us towards a long way in curing the cancers. And next important step is policies. The government should formulate a policy so that the corporate and private bodies should gather this treatment at the affordable cost.
Thank you all for coming together. And I think we need to understand one thing, that we are in the middle of a cancer pandemic. There is no question about that. 14 lakh cancer diagnoses happen in India per year. Of the 14 lakh, the vast majority, about 8 lakh people die from cancer. It is one of the highest mortality rates we have compared to the Western world, where a significant portion of the cancers are cured. And the reasons why most of our patients die, we have anecdotal evidences that maybe because they present late, maybe they are not aware of the diagnosis, or maybe the incidence level is quite high, but these are anecdotal evidences. We don't know for sure because we don't have accurate data. We have independent people trying to make cancer registries. We have some from Karnataka, some from other states, but we don't have a national database. As clinicians, what I know is that maybe gallbladder cancers are more common in North India, stomach cancers are more common in South India. But do we have a policy for that to identify what causes these cancers and at what stage they're present? We don't. We know that the best way to reduce cancer burden is to prevent cancer from happening in the first place.
ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ ಅಸೋಸಿಯೇಷನಲ್ಲಿ ನಾವು ಈಗ ಗೌರ್ಮೆಂಟಿಗೆ ಒಂದು ವಿನಂತಿ ಮಾಡ್ಕೊಳ್ತಾ ಇರೋದೇನು ಅಂತಂದರೆ, ಸೊ ಕ್ಯಾನ್ಸರ್ನ ಒಂದು ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಆಗಿ ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಕ್ಯಾನ್ಸರ್ನ ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಮಾಡಿದ್ರೆ ಅದರಿಂದ ತುಂಬ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಏನಕ್ಕೆ ಅಂತಂದರೆ ಎಷ್ಟು ಜನ ನಮ್ಮ ಬರ್ಡನ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಎಷ್ಟಿದೆ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ. ಇದರಿಂದ ಸೊ ಮುಂದೆ ಏನೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಕ್ಲಿಯರಾಗಿ ಮಾಡ್ಕೊಳ್ಳೋವಂಥದ್ದು, ಯಾವುದೇ ಮುಂದಕ್ಕೆ ಯಾವುದೇ ಉದ್ದೇಶದಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಮತ್ತು ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಯಾವ ಥರ ಡೆವಲಪ್ಮೆಂಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಎವ್ರಿ ಪೆನ್ನಿ ವಿಚ್ ಈಸ್ ಯೂಸ್ಡ್ ಶುಡ್ ಡೆಫಿನೆಟ್ಲಿ ಸೇವ್ ದ ಮಿಲಿಯನ್ಸ್ ಆಫ್ ಪೀಪಲ್. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನೋಟಿಫೈ ಮಾಡಬೇಕು ಅಂತ ನಮ್ಮ ಉದ್ದೇಶ.
15 years back, but till date we do not have a unified cancer policy, which is a national policy to declare cancer as a notifiable disease. It's a divided mandate, with some of the states making it voluntary, some of them making it mandatory. If we have this working in silos, we'll not be able to have a national policy on cancer. The importance of notifying this, as spoken by my other colleagues, is we'll be able to have data, we'll be able to create a registry, we'll be able to understand the underlying reasons, and also region-wise understand the burden of cancer and take steps to not only treat people but also raise awareness, early diagnosis, and reduce the burden of cancer. It's high time for a country like India with 1.5 billion people that we look at the huge burden of cancer which has been depriving people of their livelihoods, or probably also a burden to the economy, and step forward to pass a legislation to actually making it notifiable under the national policy. Thank you.